It's time for Nip Talk.
Actually, the story we have today is actually very sad. It involves somebody who I really look up to, Hank Williams Jr. I grew up listening to country music and always loved Hank Williams Jr. And so I guess it was March, his wife died kind of unexpectedly, and there wasn't a whole lot about it in the news at the time. But in the past couple weeks, there was actually an autopsy report that came out, and it kind of shed light on what happened to her. And I don't know how much you know about this, but basically she died a day after having plastic surgery. And so when I saw that, I immediately wanted to kind of dig in there and kind of see like what were the circumstances of this. I mean, a death after plastic surgery is not very common. We're going to talk about some statistics on that. So I started doing some digging, and it was kind of tough because I wanted to know like the medical stuff, like what procedures was she having, how did they do them, where was it done?
What was her past medical history?
Exactly right, yeah. So like the doctor in me was trying to find these things, and of course the articles are very, they're for the general public, so they're kind of generic. But after combing a bunch of articles, I did I was able to find some information. So she actually traveled for surgery. She went from Tennessee to Florida to a surgeon who the first thing I wanted to know is this guy, a board-certified plastic surgeon,
of course.
Which he was. There he is. He's actually a pretty well-known surgeon. I looked at his credentials. Like he's very legit. A good guy. So that was the first thing is did she go to somebody that shouldn't be operating on her? And the answer was she did. The guy was totally good. Then I wanted to know what procedures she had. So she had breast implants, and she wanted them out. So they took out her breast implants, and then they did a breast lift, which is very common because if you have implants, you take them out, everything kind of collapses, so you have to lift up. In fact, I did that exact surgery today, this morning, did implant removal and a lift. But then they did liposuction, and then they took that fat and re-injected it into her breast in order to try and gain some of that volume back. And she had the surgery done. She went to a facility to recover. The first day after surgery, she was sitting up in bed talking to, I guess, a family member, and she suddenly became unresponsive. They called 911, they took her to the ER, and she was pronounced dead.
So immediate for somebody that seems so rather young.
Yeah, she was pretty young. Yeah, and her name, I'm sorry, is Mary Jane Thomas. She was 58, I believe. She was in her 50s, so she's definitely a young person, not old at all. And so I looked into, basically the autopsy report came out, and it said that she died from a pneumothorax from the fat grafting. So for those who are not familiar with medical terms, a pneumothorax is basically a collapsed lung. If you are working around the chest cavity and you puncture that layer that's around the lung, what happens is that air will start to fill in between your ribs and the lung and collapse the lung, and further it will push your heart to the point that the blood flow cannot come back to the heart, and you will very quickly die from that. And normally if you have a collapsed lung, it's something that you would know about, right? You'd be like, oh, I don't feel good, my chest hurts. Well, she had just had surgery.
So
she didn't know. She was on pain medication. She expected to be sore, and so the pain that she had from her pneumothorax, she probably chalked up to this is normal. Well, the problem with tension pneumothorax is like you can tolerate it for so long, and then you die. And so that's what happened to her. And so I just want to kind of unpack a few things about her death, and let's break this down because this is not something that is very normal. I have a little bit of issue with people traveling for surgery. I don't at all want to say that the reason that she died was because she traveled for surgery, but it just is one factor that does make things a little bit more challenging. And I have people who find me on social media because I have kind of a social media following these days, and so people will see my befores and afters, and I get calls from people that live in New York or California, and they're like, oh, I love your results, can I come out? And so I've had a couple people do it. My hesitancy in that is it tends to be rushed. And so, with this doctor, like, did she just show up and they just suddenly made a plan and did surgery the next day?
Or did they do pre-op, post-op?
Yeah, and in this instance where she didn't have like some underlying problem like that, the pre-op is important, but like for her, I mean, this was more of an accident, right, as opposed to like a medical condition. But you're on the right track that it can be rushed, and so I don't like that. But I mean, please don't take that as like, oh, she had a bad outcome because she traveled. Because a lot of people travel surgery. But it is something I just kind of bring up, like, if people ask me how can I make sure that I have like a good plastic surgery experience, like I'm going to say board certified surgeon, which we know he was, and then I'm going to say find someone near you. It makes it easier like in your post-op care as well. And I think in this instance it didn't make a difference, but it is one thing that just kind of perked my ears up. The other thing I had a question about this is the fact that she had a lift and fat grafting at the same time. I personally won't do that.
Now, why is that?
Well, so everything you do to the tissue stresses it to a certain degree. So when you take out the implants, that's going to stress the underside of the breast a little bit because you take out the implant and you take out the layer around it, and it does put a little bit of stress on the breast, not to mention the cut to get underneath it. And then when you do a lift, you're further stressing the breast just a little bit. And then if on top of that you do something else, like inject the tissue with a bunch of fat, I feel like you run the risk of the tissue getting injured. And so when I have patients come in, and I've had patients just like her who remove implants and have a lift and they ask about fat grafting, I make them break it apart. And once again, I don't think that that's why that accident occurred. It's just I'm very conservative. I'm busy. I can pick who I want to operate on. If people want to do crazy stuff, I'm just like, I'm not interested, you know. And I personally wouldn't have done that, but I don't think at all that was the reason that this happened.
Just another factor, maybe.
It's just like another thing, yeah. I'm just like, you know, because I'm trying to play devil's advocate, right? It's like, you know, I'm looking at this, and of course, I don't want this to happen to my patients. I mean, I don't want it to happen to any patient. I feel bad for this guy because obviously it was, you know, just an accident. But I do like to kind of break these things down and see, okay, is there anything that was like, you know, noteworthy? And I'd say this is just a footnote, it's a small thing. I wouldn't have combined those, but I don't think it had anything to do with that. I did have a question though about whether it was done under local or general. I tried to look this guy up. I think he does have an OR in his facility. And so I would imagine they did it under general anesthesia. I would have big concerns if this was done under local. I couldn't find the answer to that question. I have to assume it was under general anesthesia.
Is this a long surgery then?
It's fairly long, yeah. And it would be, I mean, I've actually done things like a breast augmentation under local, just kind of a test run. I did it. I did a couple. I've done some lipo under local. You can do it. It adds another wrinkle to it. And the one thing that came to my mind is when you're doing procedures where you're either doing lipo or fat grafting and people are under local, if they suddenly feel a pain, they can jump. And so like if a patient jumps while you're using something sharp, like you could end up injuring something. And I have to imagine this was under general, but I mean, I don't know that, you know, that'd just be one question I have. And the other thing too, like that I asked myself is, you know, do I think the surgeon would be held liable, like from a malpractice standpoint? I mean,
yeah, that's always interesting to ask.
I think probably will. I mean, because it's an act. I mean, you know, when I do lipo, when I do fat grafting, like it becomes very routine because you do this stuff so frequently. But like the number one thing that you have to be careful about is not puncturing either the chest cavity or the abdominal cavity for these exact reasons. And I've done lipo on people that I've done tummy tucks on, and like I'll do the lipo first and then I open them up and I'm saying, oh man, I just kind of skimmed the muscle a little bit. Like I didn't poke through it, but I just kind of skimmed it. Right. And so that's what you it's okay to skim it, like it doesn't hurt it, but like you don't want it to go down into it, whether it be the abdomen or the chest. And so, you know, whenever I'm doing lipo, and I'm sure every plastic surgeon is the same, like you really have to kind of pay attention. Like it's, you know, it's a very routine procedure, but you can't get too deep because you can cause injuries. And so, you know, if an injury like that occurs, like it's kind of on the surgeon. I mean, unless there's something I don't know about, like, and all I know is from the research I did, like from the autopsy report and the articles, maybe something else happened I don't know about. But
so you found the autopsy report and you were able to?
Well, it wasn't like the full report. It just said the conclusion.
Oh,
it just said patient died from pneumothorax from fat grafting. Because that was the question, like, you know, did she die from the lipo part, or was it? It did say specifically the fat grafting. So. So I pulled up some just kind of statistics on death rates, because that's an interesting topic, right? Like, because if you go ask somebody like, how likely am I to die from surgery? They probably don't. Thing. It can happen, but like people probably don't know the statistics. So I dug into it, and I had a general idea, and I was kind of pretty close. So if you're having emergency surgery, say you're in a car wreck, and you have to go to the OR because you're injured, your risk of death is about 1 in 60. So whatever percent that would be, like 1.7%.
But you probably are coming in with much more.
Of course, right? Yeah, it's an emergency surgery, right? You have something really bad. You need the surgery. You're going to die. So obviously, that's going to be pretty high. Now, if you go to just elective surgeries in general, then the rate's about 1 in 600. So that means I'm going to have like an elective colon surgery. I'm going to have an elective gallbladder surgery, whatever. Then your risk of death is about 1 in 600, with the most common cause of death being sepsis, meaning infection, you know, general infection. Now, for plastic surgery, plastic surgeries are generally not as invasive. They also tend to be on younger, more healthy patients.
Right.
Your risk of dying from a plastic surgery is around 1 in 300,000. So
wow, that's a big difference.
Way different, yeah. So it does make a difference that these, that the plastic surgeries are on healthy people and more superficial.
Right. There just aren't those underlying complications with the general public.
Right, yeah. Generally tends to be healthier people. Right. So yeah, I mean, because, you might see the story about her and think, oh God, I'm never having plastic surgery because she died. Well, statistically, it's extremely unlikely that that's going to happen. And so when it does happen, of course, you want to kind of look into it and see, did something happen or whatever. And honestly, from looking at this, I think it was just an accident. I mean, it's just like, whatever job you have, like you can have an accident in your job. And I think that that's just what happened, and it's very unfortunate for her and for Hank and all that. It's terrible, but
it is awful.
But it is good to look at these things, right? I mean, you don't want to brush them over because you hope that there's something you can learn from it to prevent it.
But they are kind of sensationalized because of
they
who
are
they
too.
are.
Yeah,
and
totally. Yeah, I mean, it's a shame. I mean, I hate that. And of course, to a certain degree, we're doing the same thing. It's like, oh, Hank Williams, Jr. wife died.
It's nice to dissect it, though.
Right.
Kind of see, why did this happen?
Tastefully kind of figure out.
Right.
Yeah.
Right.
All right. So moving on to our next segment. Travis, how are we on time? Am I rambling too much?
No. You're providing some good information, if anything. So rambling probably wouldn't be the best way to describe it.
Okay. All right.
you are giving some very in-depth info.
Yeah. What'd you think about all that?
It sounds like a very unfortunate situation. You know what I mean?
Yeah.
Nobody ever thinks that when they elect to do something like that, they're not going to come out on the other side okay.
Right.
And even for Hank, I'm sure.
I'm sure he's
devastated.
terribly.
Yeah. Sure
it's terrible. So. I mean, I just my deepest sympathies to them. Looking at this is not in any way trying to make light of it. Like it's just really,
Absolutely.
Can we learn anything from
right.
it? Like and for me as someone who does these surgeries, is there anything I can learn from this to make sure it doesn't happen moving forward?
I will say as well too, your inner doctor comes out because you dissected every little bit of it.
I did, right?
You went and researched almost every part of it. So
I know. I was like sitting there looking at all those research or looking at those articles, trying to figure it out.
Absolutely. No, that's so interesting.